Welcome to the Experts in Medicine Talk series. This series is brought to you by Handbooks in Healthcare, leading publisher of clinical pocket references by the world-leading medical experts. Today, we are joined by Joel Young, leading expert in ADHD throughout the life cycle and author of Contemporary Guide to Adult ADD/ADHD.
Hi, my name is Joel Young, and I'm a psychiatrist and medical director of the Rochester Center for Behavioral Medicine outside of Detroit. I'm also assistant clinical professor of psychiatry at the Wayne State University School of Medicine, and I'm committed to training psychiatrists, psychologists, and other mental health professionals. For the past 15 years, my primary area of clinical interest has been ADHD through the lifespan. In this capacity, I have treated many patients with ADHD and related disorders, and I supervise many therapists who are also involved in caring for these individuals. I lecture throughout the country, and I've been involved in any number of continuing medical education projects. I've been an active contributor to the academic literature and have authored a number of articles and textbook chapters. In addition, I've been primary investigator for many ADHD medication trials. Almost all the currently available agents have been studied in our facility. I'm excited that I've been asked to write an updated guidebook on adult ADHD. Thus far, it has been a pleasure to work with my publisher, Handbooks in Healthcare. I continue to be fascinated by the field of adult ADHD. ADHD is one of the most exciting fields in contemporary psychiatry. We know that between 6 and 9% of American children suffer from ADHD. In 2006, Dr. Ron Kessler from Harvard published data that quantified 4.4% of American adults continue to have ADHD into adulthood. The revelation is ADHD does not go away. Contrary to the magical thinking of the past, we now know that an individual does not give back his ADHD in exchange for his high school diploma. A convenient handbook will be a significant addition to what is currently available to doctors. As it stands now, ADHD is a consumer-driven disorder. In other words, the public learns about the condition through the media or through friends, or maybe one of the most common ways is that their children have been diagnosed. They read about ADHD, and many of them will say, I think I have this myself. Then they often approach their primary care doctors to obtain further clarification. One of the problems with adult ADHD is that most doctors do not feel comfortable with the diagnosis or treatment of the condition. As a result, they tend to deflect a patient's inquiries. As a result, many individuals who have ADHD have been diagnosed with other conditions, particularly depression, because doctors are uncomfortable in the ADHD arena. Over the past 10 years, I have traveled the country extensively talking about this condition, and uniformly I hear from my colleagues, they lament that during their residency training they did not receive much about adult ADHD. This extends not only to primary care doctors, but to psychiatrists as well, particularly adult psychiatrists. When these doctors are approached by the patients, many doctors find themselves in the difficult position of having to respond, and they try and be intelligent about the patient's inquiry. Having a convenient and accessible handbook about ADHD, which will facilitate the process of diagnosis and treatment, will be well received. Ultimately, the goal of all of us who treat this disorder is that in the next decade or so, doctors will be able to educate patients and proactively inform them that they have ADHD. This is what happens with hypertension and diabetes. ADHD should not be a diagnosis of exclusion, and this handbook will allow doctors to be more proactive and less passive about the diagnosis. ADHD has always appealed to me because there are so many aspects to this disorder. We know that it is a valid diagnosis. We know that there is basic science, certainly as we look at neuroimaging and brain research. As I mentioned before, it's a highly prevalent disorder, and it's also associated with a number of comorbidities, which this handbook will cover, including ADHD and anxiety, depression, and the whole issue of ADHD versus bipolar disorder. ADHD and substance use will be given a clinical update as well, as we have some new research in this regard. My book will also summarize some of the longitudinal studies that have been recently published. Over the past 2 years, Dr. Joe Biederman and his colleagues have published controlled studies of functional impairment associated with adult ADHD. Their data supports the fact that those with ADHD, compared to those without the condition, have higher rates of divorce, tobacco addiction, excessive alcoholic use, recreational drug use, etc. In addition, compared to those without the ADHD condition, individuals with ADHD have more likely been arrested or they have been involved in multiple vehicle accidents. In 2008, Dr. Russell Barkley published an important book called ADHD, What the Science Says. He spent a lifetime studying the longitudinal effects of ADHD. He followed hyperactive boys over a 20-year period and found that their outcomes were poor. These young adults were more likely to have lower educational attainment and higher rates of substance use disorder, impaired relationships, and criminal activity. In every domain followed in the study, patients with ADHD did quite poorly. Now, his study is a huge accomplishment. What I tried to do in my book is encapsulate his findings so they are accessible to the clinician. Dr. Barkley's book is over 500 pages and is quite encyclopedic and frankly foreboding to read. I'm hoping that my book will crystallize some of these points. These findings fortify the argument that ADHD is a public health problem that needs to be addressed. My handbook is targeted at busy clinicians. For this reason, I intend to include ADHD rating scales to help in the diagnosis of ADHD. The rating scales that I intend to include can be replicated as they are in the public domain. I will also include a section dealing with community resources and consumer-friendly websites so that physicians will find the book to be one-stop shopping when it comes to ADHD resources. We also have some discussion about the natural history of ADHD, and I've included some of my research which suggests that in the fourth or fifth decade of life, individuals with ADHD, particularly inattentive ADHD, might develop chronic fatigue syndrome and fibromyalgia. We also have found that doctors are very concerned about the medications that are used, and there are 4 specific medications specifically approved for the treatment of ADHD. One of those was just approved, and there are very few published resources about it in independent literature, and I have included an update on the new medications, Vyvanse, but also the other 3 that have existed. We also will have a section on questions and answers. As people browse books, they often go to the question-answer section, so we've selected 20 very frequently asked questions, and we believe this will make the book more accessible. In the end, I think this handbook will be an important addition to the field. My goal is to make it up-to-date, readable, and accessible. I foresee this handbook in the hip pocket of many lab coats, and since my name is on the cover, I'm trying to make this book as good as it can be.
Thanks for tuning in to the Experts in Medicine Talk Series, brought to you by Handbooks in Healthcare. If you are interested in purchasing copies of this or any other titles by Handbooks in Healthcare, please call 800-860-9544 or email custserve@hhcbooks.com. All Handbooks in Healthcare titles retail for under $25 a copy and can be purchased in bulk quantities at substantial discounts. Handbooks in Healthcare can be found on the web at www.hhcbooks.com.